بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. آمين يا الله. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is presenting some cases of clavicular pathology in chest in the brain films. Here, this is the normal clavicle. This is the sternal part, and this is the distal part with articulation with acromion, and we call it, this is acromioclavicular joint, and here we call it sternoclavicular joint. Here, this patient with bilateral clavicular fracture in this supine chest X-ray, more pronounced on the left side. Here is another patient with fractured clavicle with displacement of this part according in relation to the rest of the clavicle, and this is associated also with the fracture scapula and multiple rib fracture and right-sided pneumothorax in this supine film. Here, this is another patient with displaced fracture of the lateral end of the clavicle in this young male after falling from a bicycle. And here, this is the X-ray after internal fixation 1 year of this patient. And we still see some resorption of the distal end of the clavicle and some separation of the acromioclavicular joint. Here another patient with the distal resorption of distal end of the clavicle associated with soft tissue swelling superior to it in the relation to the acromioclavicular joint. And here, this is the same patient with MRI with a large effusion with communication with acromioclavicular joint and a large defect in the of the rotator cuff. Here, another patient with hyperparathyroidism with the distal end of the right clavicular resorption. Usually, the hyperparathyroidism cause bilateral distal end of the clavicular resorption. Here, another patient with secondary hyperparathyroidism with resorption of bilateral distal end clavicular resorption. Also, there are many causes of bilateral resorption, as we see here in this patient, female patient with the resorption of bilateral end of the distal end of the clavicles. And here, this is a spot view to the right side. We see in this patient with rheumatoid arthritis. Here, another patient with resorption of distal end of the clavicle with post-trauma. post-traumatic resorption. Here another patient with distal end clavicle osteolysis. Here this is the patient with cleidocranial dystosis, and we see absence of the right clavicle and hypoplasia of the left clavicle as we see here. Here this is the patient with the sclerotic clavicle, and this patient proved to have eosinophilic granuloma. Here another patient, 12 years old, with permeative destruction of the clavicle with periosteal reaction, and in this patient proved to be Ewing sarcoma of the left clavicle. Here another patient, female patient with destruction of distal end of the clavicle associated with soft tissue swelling, and this is metastasis from breast cancer. Thank you very much for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.